it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
So the topic is accessing affordable healthcare, tips and tricks. I don't know whether we've got tricks, but hopefully we can share some tips on trying to make healthcare a little bit easier to navigate, at least here in Sydney. But I always like to start with disclaimers, then you understand our biases. And so this talk is pitched towards the people that we see at BJC Health, to you as patients, and many of our patients who present with a rheumatic disease or rheumatic conditions, and those of you that suffer significant joint and musculoskeletal aches and pains. And by no means, even though there's lots of experience here on our panel, by no means are we experts in navigating the healthcare system. We can share with you our experiences and of course some tips in terms of what we've learned and the stories that patients have shared. But at the same time, talking about affordable healthcare, I might make a comment or two that might not sit well with you. That's not my intention. And please just understand my biases, because I really don't want to open up a bit of a minefield. Yep, so that's the disclaimer before I start. Oops, just gonna go forward. Now, I thought I'd start off with a definition of what affordable is. And all of us can then make our own assessment as to whether healthcare in this country is affordable or not. And when I Google searched it, affordable means something that's inexpensive or reasonably priced. And then I thought, this word reasonable, it gets used so much in legal documentation. Reasonable, upon searching, is fair and sensible. So affordable really can mean anything, right? It all depends on whether you think it's affordable and whether you think it's fair and sensible to you. And so then the question is, can healthcare in Australia really be affordable, especially in the current climate of inflation and so forth? And really, it's not me to judge whether it is or it isn't, but I thought it's important to at least make that distinction or define what affordable means. Because for me, it really doesn't matter, should it, what affordable means, because really we're here to try to figure out what supports there are here in Australia, or at least in Sydney, and whether we can maximize these supports that currently exist to lead you to better health. And that's for all of you. The second part of this is if we can all be better planners in terms of trying to figure out what healthcare costs we need. Even if you plan for the next 3 months, 6 months, if you're a great planner, you plan for decades ahead, that helps. Yeah. And if you can maximize the supports, plan well. And if you can do the third thing, which is do everything that prevents your health from worsening, really, those are the things that hopefully will keep you in better nick, and you don't have to see us as doctors or health practitioners as much. Now, I forgot to introduce myself. I just remembered. By the way, for those of you who don't know, I'm a physiotherapist by trade. My name's Errol Lim. I've been a physio for 25 years, and I'm now the managing director of BJC Health. So I thought before, now I am going to go to the next slide where I actually give you some information. But we think for the patients that come into BJC Health, this is an ideal journey for them. They've seen their GP. Yeah, the GP either gives them a diagnosis, or they might be referred, or many of our patients are referred to our rheumatologists. And then the aim there is to try to get a diagnosis of some sort, and a definitive diagnosis, so that you can get either the appropriate medications or the appropriate plan of attack to try to get a better outcome. Often, many of our patients also require input from allied health, which means a physio, an EP, a podiatrist, or a hand therapist. And really the ideal in the journey for many of our patients is that if they get the right help early, they get the right medications and right plan, hopefully they can do more things for themselves. There's enough research and studies to show that if patients can do much more for themselves, their health outcomes end up being much better. And so if we can do all these things together, hopefully many of our patients and yourselves can get the best possible outcome. So with that in mind, what type of funding models exist? So of course there's Medicare. And so I've highlighted that doctor bit where we deal with medications and you see your GP and you see your medical specialists. And of course, all of you understand Medicare. But did you know that there's a Medicare safety net? And for those of you who aren't sure what Medicare safety net is, first of all, I'm no expert in the Medicare safety net because there's multiple different thresholds that exist. But basically, if you as an individual spend a certain amount on healthcare, on your medical consults, and there's a certain amount of a gap or out-of-pocket expenses that you pay, once you reach that particular threshold, Medicare registers that, and for any other consults ongoing, you get a much greater rebate back from the government. So that's the Medicare safety net. Now, there's all sorts of different, if I go back one slide, if you're an individual, apparently you don't need to register. It will just hit that threshold and you'll start getting the bigger rebates. If you're a family or couple, I'm going to ask someone to mute there because I can hear music in the background. If you're a family or a couple, you will need to register with Medicare so that they can track the right threshold amount so that you can get the extra rebates. And so there's some complexities there which I don't even understand, but I think if you think you've been seeing lots of doctors over a course of a calendar year and your expenses seem to be building up, you may want to go into your Medicare account and check your thresholds and see whether you're eligible to be in the Medicare safety net. Those of you who unfortunately may have to buy lots of medications that are on the PBS, I'm not sure whether you knew, but there's also a PBS safety net. Again, these are set, if you read right on the screen, as of the 1st of January, the PBS safety net was updated. And for concession card holders, the threshold is set at $262.80. For everyone else, it's set at $1,563. And yes, that's a lot of medications that people have to spend money on. But unfortunately, there are many patients and many of our patients who may need to be on medications lifelong and need to spend a significant amount. And so once you hit those thresholds, what happens is if you're a concession card holder, any medicines after that are free. Or if you're a general patient, the cost of those medicines now becomes $7.30. So that's the PBS safety net. So there's the Medicare safety net and the PBS safety net. Yep. I'm going to move on because I just wanted to highlight those two things that have to do with the federal government and what they provide when you go to see doctors and if you need medications. To really know the specifics, you need to go to those websites. Yep. For much of what I'm talking about, you need to do the research and to see whether you're eligible. So if you need significant allied health, right? And so now I've highlighted down on that bottom right-hand corner that maybe as part of your journey, you required some input from allied health. Well, these are the options, right? Now, if you don't have any funding, you have to pay for it outright. You may have private health insurance. And I have a slide on each of these things preceding this particular slide. There's this thing that the government came up with some 15 years ago called the Chronic Disease Management Plan. I'll talk a little bit more about that. There are local networks where you live, each and every Australian lives in a particular region that has a primary health network. And primary health networks were created some years ago by the federal governments to support GPs, allied health practitioners, and the community in primary health, so outside of the public hospital system. Yep, and they have significant programs, and they've been tasked by the federal government to help the community. So if you've not heard about them, I would suggest checking their websites out, and I'll give a couple of examples in further slides. Local councils and local hospitals have their own programs that people should be searching for, such as osteoarthritis programs. There's lots in diabetes. There's lots in refracture programs for people who have osteoporosis and so forth. And then there are other programs led by other organizations, not-for-profit organizations that do exist, definitely in the mental health space. And again, much research needs to be done there. Then there are these big programs. I'm sure many of you have heard of the NDIS. And if you've got questions, please ask them, and hopefully Joel can help you with those questions. And if you're over 65 years of age, I'm not sure whether you've heard of My Aged Care. And so I have a couple of slides on that as we go through. Brian, I know you asked about the Commonwealth Seniors Health Card. My panelists, can any of you answer that for Brian?
Yeah, it does count towards the PBS safety net within medications. Yeah.
Brian Hayden, does that help? You can answer on the chat. Thanks, Amy. I'll continue. So I have a slide on private health. There's so many options. When I started 25 years ago, there were much fewer options, and it was so simple. You used to be able to go to your local physiotherapist and definitely your dentist, and they would have a card, and it had all the health insurance there, and they could tell you what particular rebate you'll receive because you could tell them what specific policy you're on. There's no hope of doing that these days. There's too many variations and combinations. So the best thing I say to people, if you are thinking of purchasing private health insurance, or you have an existing private health insurance policy, it's probably a good thing to do a review. And I reckon an annual review these days, considering I've just done a review of all my insurance policies, from my car insurances, third-party home insurance, and there's a market difference between companies. I would suggest you do the same for health insurers. You should check for better inclusions, better rebates on different memberships, especially those of you who've got existing memberships with insurers and you've had it for decades. Especially if you're just used to paying the annual fee or monthly fees and it just comes out of your credit card, check. Because some of these legacy policies are probably not as good as the new ones. Please compare between insurers, and I've written down a list. That's just a small list. I think there's so many comparison sites these days, but those are some of the comparison sites that may be useful. What is CDMP? CDMP is the chronic disease management plan that I mentioned before. I'm not sure whether any of you online today understand this or know about this, but maybe about 15 years ago, a decade and a half ago, the government, Medicare, launched this particular program where all Australians who had a chronic condition deemed by the GP were able to access 5 allied health services. And you can see the allied health services on the left there per calendar year. Your GP would need to set up a GP management plan and a team care arrangement for you to be able to access these 5 sessions. I hope the panelists can help me, but I think this figure of $56 for the Medicare rebate per session is a little bit old. I think it's closer to $60. but I'm not sure. But this is what roughly you get back between $55 to $60 for each health allied health session that you may that you attend from Medicare. And again, you only get 5 of these each year. How many of you online actually know about that this exists, or your GP has told you about this for a particular chronic condition? Just say yes, or write yes in the chat so that I have an idea. Excellent. And some of you have used them. Excellent. Someone only recently came to know. Well, it's been around for 15 years. And so if you see your GP and go, well, do I qualify? Because if you have ankylosing spondylitis, rheumatoid arthritis, long-term osteoarthritis, actually chronic disease can be anything from you've had symptoms for 6 months or so, you qualify. Yeah. Reshu's asked me, do you think 5 is enough? No, Reshu, 5 is definitely not enough, but I don't think that's going to change anytime soon, because most governments around the world, including Australia, really don't have enough money to put more into healthcare. A lot of what we do in allied health, so non-doctor health services, are there, yes, to help people acutely, but there's so much more we can do to help people preventatively so that they rely less on doctors. That's really the whole point. And imagine if someone has had chronic pain or chronic disease for 10, 15, 20 years. Unfortunately, 5 sessions with, a physiotherapist or an exercise physiologist over the course of a year isn't enough to do all the things that we need to do, or all the things that we need to teach a particular patient. It may be enough if you spent a year or so or longer. I've just pulled numbers out of the thin air, but if you spent time with a physiotherapist at length and you know what you need to do, and you're going in to see the physiotherapist for checks or general assessment, those 5 sessions may be more than enough. But unfortunately, for many of the people that we see, it just isn't enough. I think a couple of recommendations are, sometimes doctors and patients like to split these sessions up amongst multiple allied health. And so then you see the podiatrist once, the dietitian once, the exercise physiology once. That makes it really, really difficult for the allied health practitioner to do anything substantial with you as the patient. So I would suggest sort of defining what's the biggest priority and perhaps utilizing more sessions with that one particular allied health service. And say you decided to see the physiotherapist 5 times in that one calendar year, rather than try to lengthen those sessions out, like try to see the physio every 2 months. I think you get more benefit by seeing the physiotherapist intensely, try to sort out your problem as quickly as possible, understand more about your body, get some things ingrained, and then maybe you've got the knowledge to be able to do your things yourself a little bit better. I tend to prefer that than trying to make the sessions last. I don't think it's as effective.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. Otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.